Hello, my dear fans and followers. I am Dr. Gala, and this is another video of the Doctor of Transformational Showcase Series. If you haven't yet, please hit the subscribe button and activate the bell so you don't miss new topics. Remember, we are not just about how to solve a problem or make your life better. It is also all about becoming more successful in every area of our lives. Today's topic is setting boundaries in difficult conversations. What are we referring to when we say boundaries? Your boundaries represent the limits of how you will allow others to treat you and speak to you. Setting your boundaries mean assertively protecting your rights to your bodily, emotional, mental, and spiritual health, your ideas, your needs, and the like. It involves the ability to stand up for your rights in a direct way without being aggressive. For example, belittling, ridiculing, forceful, or being passive. For example, minimizing what you need to say, sometimes apologizing for your needs, etc. So, a lack of boundary setting is associated with various forms of psychopathology, especially depression and social anxiety, and volatile personalities such as neuroticism. Setting personal boundaries can be regarded as an important skill for cultivating a healthy life and healthy relationship. However, many people lack this skill. People struggle to set personal boundaries for different reasons, including fear of being disliked, rejected, or being just counter-challenged. Difficulty with setting boundaries has also been found to be related to social comparison. People who tend to compare themselves unfavorably to others often experience increased stress levels, anxiety, and a reduced capacity to perform assertive behaviors. Boundary setting can be learned, even if it is taught as part of sexual assault self-defense training. Students practice setting and enforcing clear boundaries, which communicates to others that they know their desires and will not be easily deterred from protecting them. Epidemiologically talking, and I love this word, women, after being taught to assert themselves verbally and communicate their boundaries, reported lower levels of fear and higher levels of confidence in their ability to defend themselves. Boundary setting in a conversation means you are speaking up for and defending your limits when a person does, says, or makes a request for something that is not acceptable to you. This is very important because people cannot honor your limits if they don't know them. And some people will continually do, say, or push for more than is acceptable to you. Additionally, frequently allowing people to cross your limits has a lot of negative effects on you, including perpetuating low self-esteem, feeling your needs and wants are not being met, not being in control of your own life, and stress, anxiety, and resentment. Here are some scenarios to exemplify how you can communicate your boundaries. In scenario number one, let's think about an inappropriate question. At a professional networking party, someone you recently met asked an inappropriately the personal question in front of others. You are shocked, blindsided, and without thinking, you answer the question. You know your boundary is crossed because you immediately feel embarrassed and regret answering. For some time afterward, you keep thinking about it and feel angry at the other person for asking and yourself for answering. Let's see what boundary setting responses could you have given. I think you don't know me well enough to ask things like that. Here you are expressing what you think. Or you can say something like, I would rather not discuss that topic right now, if you don't mind. You'll directly express what you want, right? Here is another scenario. The intrusive coworker. A coworker frequently interrupts you in your office for help. Takes up a lot of your time and does non-stop talking off the topic. You know your boundary is being crossed because you cannot get a word in when you try. and you feel trapped and stressed by the visit. You like the person and are worried about being rude. Here is a possible boundary setting response. Hey, sorry to interrupt. I don't mind helping, but I can't talk right now. You just say what you think and need, right? It works better for me to set a specific time. And here you say what you need. How about we take 15 minutes to talk about it today at 3 p.m.? And here you just say what you need and want. Well, you can also add physically getting up and walking the person out of the office and closing the door. And that is a nonverbal communication. And you're not offending them. Scenario 3. We'll see an example of the dismissal of an idea. Your partner, your spouse asks you where you want to go to dinner. Typically you say, I don't care, and always go along with what they want. You are trying to assert yourself more. So this time you recommend a place you want to try. Your idea is dismissed. You know your boundary has been crossed because you feel upset, annoyed, feel like this is the reason you never bothered to give your opinion, right? Here's an example of a boundary setting response. I want to go back and talk about XYZ restaurant, and you're expressing what you want. Yeah? I usually say I don't care, but I do. Here you are expressing your feelings. I would feel happier, and you're talking about your feelings. If we try my choice this time, here you bring about what you want. Are you willing? You know what? People tend to be more compliant and more easily when they have a choice. Another scenario is sharing when you try to share accomplishments. Your close partner share their accomplishments or stories. You give them lots of positive attention. You feel happy to be so supportive and let the light shine on them. When you try to share accomplishments or stories, they quickly change the subject back to them and take control of the conversation. You know your boundary is being crossed because you feel unimportant, you feel unappreciated and resentful. Do you recognize this type of behavior? And it happens so often. Here are some examples of the response you may give them. I notice that when I talk about my accomplishments, you give me little attention and quickly change the subject. This is a non-judgmental description of observable behavior, right? It makes me feel unimportant and resentful. You're expressing your feelings because I'm not getting the attention I need in a friendship. And you are talking about tangible effects on you. I would feel much better if you could pay attention to my accomplishments the way I do to yours. And you say what you need. Well, here is the last scenario you may find. A racist comment. And this is very serious. Your aunt makes racist comments at her house during a family event in front of you and your children. You say nothing and move your children to another room away from her. You could respond to her with your children being present because they heard and understood her comments. You know your boundary has been crossed because you are instantly upset. Keep thinking about it and feel angry at her and at yourself for not speaking up. Well, here's an example of how you could possibly set your boundaries. You can talk to her like, Auntie, I love you, and you're expressing your feelings. I know this is your house, and I am worried that I might offend you. Here are your feelings again. Still, I have to tell you that those comments you just made are not okay with me. And you're telling her what you think. Are you willing to avoid that language in front of my children? Here you just dropped what you need. And me, of course. This is what I had for today. I hope this helps. But stay tuned for the upcoming videos, and I invite you to practice boundary setting responses. This is the way you improve